Okay. So good day everyone. So this week we will be discussing isolation and identification of Vibrio species. So Vibrio is part of the group of other fermenting gram-negative bacilli. So ang kasama niya sila Aeromonas, sila Plesiomonas, Chromobacterium, Campylobacter, and Helicobacter. Okay? So this week we will be focusing first sa Vibrio. So what is the characteristics of the genus Vibrio? Okay. So Vibrio is commonly found in aquatic environments. Okay, marine or saltwater. Yung mga seafoods natin natin sila commonly nakikita. Okay? So, Vibrios are gram-negative rods, polar-sheeted, with monotrichous or multitrichous flagella, exhibiting darting motility. Okay? So, they are curved or comma-shaped, small, straight, but highly pleomorphic. So, they are also facultatively anaerobic, oxidase positive, can reduce nitrate to nitrite except for Vibrio mechnicovi. Halophilic or salt-loving. Okay, so they require the addition of sodium for growth and accurate identification. Okay. So halophilic sila except kay Vibrio cholerae and Vibrio meniscus. So this is a sample gram stain result of Vibrio cholerae. Okay, so they are gram-negative, often comma-shaped or slightly curved rods. Okay. Okay, so this is an example photo naman, yung swarming na tinatawag natin. Swarming colonies of Vibrio parahemolyticus on the surface of solidified media. Okay. So polar flagella of Vibrio species can rotate at speeds as high as 100,000 rpm and effectively propel the bacteria in liquid as fast as 60 microns per second. So the sodium motive force powers rotation of the filament which acts as a propeller. Okay, kaya nabubuo yung swarming appearance nila. Okay. So from the point of origin ng colony, nasa-spread sila sa outer parts pa. Okay. So as you can see sa photo. So again, they are facultatively anaerobic, catalase and oxidase positive, nitrate reducers. Okay, so they can reduce nitrate to nitrite. Okay? So except for Vibrio mechnicovi. Okay. So si Vibrio mechnicovi is negative for all the three tests. So catalase and oxidase, negative din siya. Okay? So they are commonly found in a wide variety of aquatic environments, temperature sensitive, and risk of infection can be reduced by the avoidance of eating raw or undercooked shellfish. So the most clinically significant infection from a Vibrio species is caused by the Vibrio cholerae. Okay, so Vibrio cholerae is the causative agent of cholera. Other term is Asiatic cholera or epidemic cholera. Okay? So cholera is an acute diarrheal disease that is spread mainly through contaminated water. Okay? So improperly preserved and handled foods, including fish, seafood, milk, ice cream, and unpreserved meat, have been responsible also for breakouts. Okay? So ang manifestation niya is due to the cholera toxin or choleragen, which is a powerful enterotoxin. Okay? So the second, most common is the Vibrio parahemolyticus. Okay? So Vibrio parahemolyticus is the second most common Vibrio species implicated in gastroenteritis. Okay? Also, remember kay parahemolyticus, it is the number one cause of summer diarrhea in Japan. Number one cause of summer diarrhea in Japan. So what are the virulence factors of our Vibrio species? Okay. So again, when you say the virulence factor, it is the ability or the characteristic of a certain bacteria to cause an infection or damage to its host. Okay. So first, we have the lipopolysaccharide. So ano yung lipopolysaccharide? It is found in the outer membrane of gram-negative bacteria. Okay. Which acts as an endotoxin, which then elicits strong immune responses. Okay, so ano po yung lipopolysaccharide? So it is a component of the outer membrane of the cell wall. Okay? So yung term na endotoxin and lipopolysaccharide is almost synonymous lang. Okay? So we have three components of LPS. Okay, so we have your O polysaccharide side chain, your core polysaccharide, or your lipid A. Si O polysaccharide side chain or si O antigen. So O antigen is used to classify and differentiate species within each genus. Okay, so we can use that to further classify or further identify si ating Vibrio cholerae. Okay? So, we have different strains ng Vibrio cholerae. So, we have first si Vibrio cholerae O1. Okay? So, si Vibrio cholerae O1, lahat ng strains under note have a common or share a common antigen, the H antigen. H antigen or flagellar antigen. Okay? So they are furthermore divided into 6 serogroups on the basis naman of their somatic antigen or their O antigen. Okay? So again, the H stands for flagellar, si O antigen naman stands for their somatic antigen. So, what are some of the clinical manifestations ng Vibrio species? Okay, so they can range from mild gastroenteritis or simple diarrhea lang, pagtatae, to cholera. Okay, so yung cholera, disease manifestation ng cholera includes acute cases of severe gastroenteritis accompanied by vomiting and followed by diarrhea. Okay, so with that, if left untreated, cholera can result in such a rapid fluid and electrolyte loss that it leads to dehydration, hypovolemic shock, metabolic acidosis, and death in a matter of hours. So, yun. Vibrio species, so some Vibrio species can also cause wound infections from simple to necrotizing fasciitis and fetal septicemia. So ito, yeah. So patients could have uh, this following symptoms. So yung watery diarrhea, moderate cramps, vomiting, and little or if any fever. Then symptoms begin about 24 to 48 hours after the ingestion of contaminated food. Okay? Ito yung, this is for gastroenteritis. So, what are the medically important Vibrio? So, yung nabanggit ko kanina, si Vibrio cholerae serogroup O1 and O139. Okay, so these are, this type or this strain of Vibrio cholera is responsible for epidemic and pandemic cholera. Okay? So we have Vibrio cholerae serogroups non-O1 and non-O139. They are the cause of cholera-like diarrhea, mild diarrhea, and rarely extraintestinal infection. Vibrio parahemolyticus causes gastroenteritis and or extraintestinal infection. And then yung other species natin ng Vibrio, yung nagkakos ng ear, wound, soft tissue, and other extraintestinal infections, which are all uncommon naman. Okay? We have Simimiscus, Magnificus, Holisay, ayan. Okay. So here is another table. Okay. So Vibrio cholera O1, nakikita nyo, it causes the cholera, gastroenteritis, wound infection, and bacteremia. Vibrio cholera O139 causes cholera also. Non-O1, gastroenteritis, septicemia, parahemolyticus, gastroenteritis, wound infections. Ayan. So, kindly familiarize or memorize this table. Okay. So, another sample photos. So, you have on the first on the first picture, okay, so microscopic morphology ng Vibrio species under gram staining. Again, they are gram-negative, slightly curved rods. And then, pag stain naman natin siya using acridine orange, ito yung kanyang itsura. Okay. So, O129 susceptibility test. Yeah. So, here is an example ng resistant and susceptible sa antibiotics. Okay. So, most species ng Vibrio are generally susceptible to vibriostatic compound, which is the O129. Okay. So, si O129 composed of 2,4-diamino 6,7-diisopropyl propylipteridine. Okay? So, they exhibit a zone of inhibition kay vibriostatic O129. Okay? However, so this test is not as valuable with isolates from India and Bangladesh, in which resistance to O129 is common, and Vibrio cholerae isolates. Okay. So let's look at now more deeper kay Vibrio cholerae. So si Vibrio cholerae, ang characteristic niya, it exhibits a positive string test. Okay? So ang resulta niya sa string test, it produces mucoid stringing reaction after emulsification of colonies in 0.5% sodium deoxycholate. Also, all species are halophilic. Okay, so they require the addition of sodium for growth, except for cholerae and C. mimiscus, which I said kanina. Okay? So, ito yung tinatawag nating string test. Okay, so literal na string test. Okay, so it produces string. Yung loop, once inikot doon and then tinaas ng konti, makikita natin yung parang sinulid. Okay, so this is the positive string test. So, as I've mentioned kanina, yung antigenic structure ng Vibrio cholera. So, you have H stands for flagellar, O for somatic, and K for capsular antigens. So, si Vibrio cholerae, it has three major subgroups. Si cholerae O1, O139, and si non-O1. Okay? So, all of them share a common H antigen and O antigen. Okay? And then si Vibrio cholera O1 has three serogroups. Okay? So, si Ogawa, Inaba, and Hiko Jima. Also, Vibrio cholera O1 and O139 yung nag-cause ng epidemic cholera. Now, epidemic Vibrio cholera O1 strains occur in two biogroups. Okay, so you have your classic and si L-Tor. Classic is more severe and found primarily in Bangladesh. L-Tor naman is found worldwide, less severe siya, Vox-Proskauer positive, and agglutinates chicken RBC. Also, additionally, they hemolyze RBC but agglutinates chicken RBC and inhibited by polymyxin B. Okay? So again, si classic yung more severe, found primarily in Bangladesh. Si L-Tor is found worldwide and less severe. Okay? So those two are the two biogroups of the epidemic cholera. Okay. So how would we diagnose si cholera? Okay, so first off, syempre, specimen collection. Okay? So, kukolect natin si specimen of choice natin for testing sa laboratory. So, ano yung specimens natin? So, we can use body fluids, pus, tissue, swabs, are acceptable if transported in appropriate holding medium, right? Okay? Which is the Carrie Blair. Okay? And then, okay. So we use buffered glycerol silene is not recommended as a transport medium as glycerol is toxic. Okay? So strips of blotting paper is soaked in liquid stool and then placed in airtight plastic bags plus a few drops of saline to maintain moisture. So this is viable for up to 5 weeks. So if hindi pa possible na ma-process agad yung sample, we can do that. Okay? Stool collected in the course of the illness and before administration of antimicrobial agents, as we discussed sa specimen collection. So what are the culture medias that we can use in diagnosing or in culturing Vibrio? So we can use salt concentration as we can use any media as long as it has a salt concentration of at least 0.5%. Since nga halophilic ang ating mga Vibrio. Okay? So we can use nutrient agar or sheep blood agar or yung blood agar plate ba. Okay? So si SBA or chocolate agar, they produce medium to large colonies, smooth, opaque, iridescent with a greenish hue. Okay? So under kay SBA, so they are examined for a presence of alpha or beta hemolysis. Under McConkey naman, okay? So under McConkey, so Vibrio species usually produce colorless colonies. Okay? Colorless colonies kay McConkey, okay, except for Vibrio vulnificus. Okay, Vibrio vulnificus ferments lactose. Okay. So we have also TCDS or thiosulfate citrate bile salt sucrose agar. So this is recommended for clinical history if nagkaroon ng exposure to seafood or seawater ang patient or for geographic reasons. Okay? So TCBS differentiates sucrose fermenting, which has yellow colonies, from non-sucrose fermenters na green or blue-green ang colonies. Okay? So, to give you an idea kung anong species yung sucrose fermenter, so, sucrose fermenting or magkakaroon ng yellow colonies, si Vibrio cholerae and Vibrio alginolyticus. Habang non-fermenter naman ng sucrose, si Vibrio parahemolyticus, tsaka Vibrio vulnificus. Occasionally, strains of Vibrio cholerae may produce blue-green colonies due to delayed sucrose fermentation. So we can use then alkaline peptone water with 1% sodium chloride. So this is an enrichment media to enhance the isolation of Vibrios. So incubated for 5 to 8 hours before natin i-subculture sa TCBS. So this is an example ng TCBS. So colonies of Vibrio cholerae going on thiosulfate, citrate, bile salt, agar. Okay? So it produces glistening yellow colonies since they are sucrose fermenter nga. Okay? So Vibrio cholerae are facultatively anaerobic, meaning they can use oxygen but not dependent. Pwede pa rin silang mabuhay kahit walang oxygen. They grow well at 37 degrees Celsius with a very, very high pH and are rapidly killed by acid. So, ayan. So, makikita nyo yung colonies again, yellow colonies, si Vibrio cholerae. And then, sucrose non-fermenter Vibrio parahemolyticus, kulay green, ang colonies. Okay. Another example photos now, Vibrio cholerae and on TCBS. Here is a summary to summarize the difference between Vibrio, Aeromonas, and Plesiomonas. Okay, so we can look at the gram-stain reaction. They are both or all of them are gram-negative since isang group nga lang sila, non-fermenting gram-negative bacilli. Oxidase activity, lahat sila is positive. O1 to 9 susceptibility, this is an antibiotic, sort of. Ang susceptible ay si Vibrio and Plesiomonas. Aeromonas is resistant. TCBS agar ang tutubo lang kay Vibrio. Si Vibrio lang ang tutubo sa TCBS agar. Halophilic, 6.5 sodium chloride, si Vibrio lang. Okay? So, acid from or fermenter, meaning if they are a fermenter. So, glucose, all of them are positive. Inositol, ang positive lang ay si Plesiomonas. Si mannitol, si negative lang ay si Plesiomonas. And then, gelatin liquefaction, ang negative lang ay si Plesiomonas. Okay. So, definitive identification, we have 6 groups. Okay? So, ang factors natin, we have growth in nutrient agar, with 6% sodium chloride. Okay, oxidase production, nitrate reduced to nitrite, inositol fermentation, arginine dihydrolase, lysine decarboxylase, and ornithine decarboxylase. Okay? So, no need for explanation naman na tong part na to. Just familiarize yourself. Sino-sino ba yung positive, sino yung negative. Sino yung variable. So this is a guide, sample guide that we can use to identify the bacteria. Okay, so once we receive the specimen, provided na, uh, sorry, once we receive the specimen, optional, we can use the enrichment media as alkaline peptone water nga to promote more bacterial growth. Okay, and then we can proceed to subculturing on TCBS. Pag nagkaroon ng yellow colonies, we know na it is sucrose fermenter. Okay, so we can test it or subculture it in a non-selective agar. So, optional na lang si oxidase test since we know na Vibrio species naman is oxidase positive, di ba? Okay? And then, except lang kay Mechnicovi. Okay. So, we can use Vibrio cholera 01 serology test na. Okay? Pag nag-positive doon, okay? Pag nag-positive sa cholera sa serology test, so we can know na it is Ogawa or Inaba. Okay, so sorry. We can test for Ogawa or Inaba serology. Pag nag-positive doon, so either of the two ang strain na meron tayo. If negative naman kay O1, okay, so we can test for O139 pag nag-positive doon, edi positive sa O139 na. Okay, and then once we know what kind of bacteria na ang meron tayo, so we can proceed to antimicrobial susceptibility testing na para malaman natin anong bacteria ba, anong antibiotic ba ang mag-work against that specific strain. So, slide agglutination tests. Sorry. The Vibrio cholerae organisms are further identified by slide agglutination testing. So, using anti-O group 1 or group 139 anti-sera and by biochemical reaction patterns. So, yung sa table natin kanina or sa flowchart natin kanina, yung serology testing, that is done through the slide agglutination tests. Okay, so we use a different or commercially prepared anti-sera na. Okay, so to test. So the diagnosis of cholera under field conditions has been reported to be facilitated by a sensitive and specific immunochromatographic dipstick test. Okay. So, since agglutination test, so ang positive result kapag nagkaroon ng agglutination. And the negative kapag walang agglutination. Okay. So, sample photos again, Vibrio species sa nutrient agar. Here, yung A. B, comparison ng sucrose fermenter and non-sucrose fermenter. And then, C is a comparison ng hemolytic colony and non-hemolytic colonies. Ayan. So, for this one, familiarize yourself po ulit. No need for explanation na. Ito yung resulta ng Vibrio cholera under different testing. So, biochemical test of Vibrio cholerae. Okay. So, methyl red, Vaux-Proskauer, Simon citrate, asan na yun? Kia, and motility indole urease test. Okay. So, positive for indole, methyl red is negative, Vaux-Proskauer is positive, positive for citrate. So, Kia, I think this is Lia. Okay. Lia is A over A plus H2S. And then, positive for motility indole urease test. So to summarize, Vibrio species are halophilic, oxidase positive, motile curve, gram-negative rods that are found in surface waters worldwide. Okay, so many Vibrio species are pathogenic for humans, but Vibrio cholerae is the species of most global importance. Okay, and other diagnosis is made by culturing stool and selective medium such as TCBS or alkaline peptone broth. And treatment involves rehydration and secondarily tetracycline or doxycycline can be used. So that's it po for our discussion this week. And thank you po for listening.